Welcome. This presentation is on key culprits in developing heart disease, prepared by Robert O. Cherry, MD, MSc. Cardiovascular disease, or CVD, is a leading cause of premature morbidity and mortality. It includes conditions such as coronary heart disease, stroke, heart failure, and peripheral artery disease. Heart disease is the leading cause of death for men, women, and people of most racial groups. In fact, in 2022, the equivalent of 1 in every 5 deaths was caused by heart disease. The good news is that identifying and modifying risk factors is the key to primary prevention. Deaths due to CVD have declined over the past 40 years thanks to earlier diagnosis and more aggressive treatment of modifiable risk factors, such as smoking cessation and the management of hypertension and dyslipidemia. Let's look at hypertension, or high blood pressure. Your systolic blood pressure, the top number, is the pressure in your arteries when your heart squeezes. The diastolic pressure, the bottom number, is the pressure when your heart relaxes between beats. Together, these numbers show how hard your blood is pushing on your artery walls, which indicates the health of your heart and blood vessels. All individuals aged 18 and older should undergo blood pressure screening. American Heart Association guidelines define hypertension as a systolic pressure of 130 or higher or a diastolic pressure of 80 or higher. There is a linear relationship here. Your cardiovascular risk doubles for every 20 millimeters of mercury increase in systolic or 10 millimeters of mercury increase in diastolic pressure. You can improve your blood pressure without medications through specific lifestyle interventions. Losing just 1 kilogram of weight can reduce your blood pressure by 1 millimeter of mercury. A healthy DASH diet, rich in whole grains, fruits, and vegetables, can reduce high blood pressure by up to 11 millimeters of mercury. Reducing salt intake to less than 1,500 milligrams per day can drop it by 4 millimeters of mercury. And 90 to 150 minutes of aerobic exercise per week can lead to a reduction of 5 to 8 millimeters of mercury. Diabetes is another major culprit. Screening is typically recommended for adults ages 35 to 70 who are overweight or have other risk factors. Diagnosis is often based on an A1C of 6.5% or higher, which reflects your average blood sugar over 3 months, or a fasting blood glucose of 126 or higher. To treat diabetes, we use medications alongside lifestyle changes. By losing weight and increasing physical activity, you can expect your A1C to decrease by 1 to 2%. For example, an A1C of 7% could potentially be reduced to 5% through lifestyle alone. Medications like metformin or insulin provide further reductions, and many other options are available depending on your needs. Weight also plays a critical role. Overweight is defined by a BMI of 25 to 29.9, while obesity is a BMI of 30 or higher. BMI is a simple way to see if your weight is in a healthy range for your height. Obesity increases the risk of heart failure, atrial fibrillation, and sudden cardiac death, and contributes to hypertension and insulin resistance. Even a small weight loss of 5% can reduce your cardiovascular risk. The key to sustainable weight loss is understanding that 1 pound equals about 3,500 calories. By reducing your daily intake by 500 calories, you can theoretically lose 1 pound every week. To support this, focus on what you eat. Avoid ultra-processed foods, sugary drinks, white bread, and foods high in sodium or trans fats. Instead, choose green leafy vegetables, fruits, whole grains, fish, lean poultry, and healthy oils like olive or corn oil. Finally, we must manage dyslipidemia, or high cholesterol. Screening is recommended for all adults 20 and older. We assess your bad LDL cholesterol, good HDL cholesterol, and triglycerides. Using a risk calculator, we determine if you should start with lifestyle interventions or progress to medications like statins. By addressing these key culprits through screening and lifestyle changes, you can significantly lower your risk and protect your heart health.